Great. I want to thank our presenters today. We have Lilia Moreno Fletcher, a navigator for the Southeast Louisiana Area Health Education Center. And then we also have Jeanette Contreras, lead outreach specialist with the Centers for Medicare and Medicaid Services. And Jeanette?
Hi, can you hear me?
All right. Yes.
So, should I get started?
Yes, sorry.
That's okay. All right, well, good afternoon, everybody, or morning if you're on the West Coast. Thank you for joining today. My name is Jeanette Contreras. I work in, basically I do outreach, partner engagement for the Centers for Medicare and Medicaid Services, which is the health insurance charged with implementing the health insurance marketplaces or exchanges, as some people know them. So I'm going to start today, before I dive into practices for reminding you of when first slide. Will I be advancing the slides or?
I'm running for what that alternate reason, but
Yes, will you be advancing this?
That's fine. We'll type it up.
Right, so I'll just say next slide when we're ready to go, but this is where we want to be. Okay,
yes.
Great.
And just a quick reminder, everyone, please make sure to mute your lines to avoid those background noises. Thank you. Go ahead, Jeanette. Sorry.
Somebody in Hart County the other day, and they said that if I could get in front of a judge and let the judge know that I have to stamp,
Get started. I want to remind everybody that the next open enrollment period begins November 15th and will run through February 2015, February 15th to be exact. And this year it's going to be particularly challenging because we're going to have to enroll new consumers. We'll have only 3 months to enroll new consumers, as well as re-enroll or renew our current marketplace customers and consumers. So I'm going to talk a little bit about re-enrollment for current marketplace consumers and talk a little bit about special enrollment periods, and take this opportunity to remind you that at any time, if you're eligible, you can enroll for Medicaid or CHIP. We have a hashtag campaign going right now for any live or go to it to see shared out there on Medicaid and CHIP. We've actually seen a great increase in Medicaid and CHIP enrollment since we've launched or implemented the marketplace enrollment. It's sort of like a wonderful side story to tell as well. And if for any sort of outreach materials, I would refer you to insurekidsnow.gov, which this spring, late spring, we launched some wonderful outreach resources like posters and infographics and things like that, both in English and in Spanish, that look really well, look really sharp. So we'll start with the next slide on talking about renewal and auto-enrollment. So in 2014, all marketplace health plans are going to come up for renewal. If you have a current plan, your insurance company is going to send you a notice this fall, probably already in the mail, to tell you about any updates in your benefits and your premiums. And now typically for those of us that have had employer-sponsored insurance, this is pretty standard. Every year you get a sort of an update saying, thanks for being a customer, here are your benefits for next year. But in this case, I would urge people to go through and review for that. And so some things that are typical is your premium may go up a little bit. It may go down. Considering that this year our good news is that we now have 25% more health plans in the health insurance marketplace than we did last year. So with more health plans, it brings more competition, and so in some cases, premiums may be going down. Benefits may also change in ways like the providers within the network of the plan may change a little bit. So it's worth going through and reviewing your benefits just to make sure your plan still meets your needs. Now, if you're happy with your current plan and you want to keep it, and your income or household size hasn't changed, you don't need to do anything. You will be auto-enrolled in the same plan for 2015. However, I would caveat that because every year, according to the number of plans in the markets and the average prices, the amount of your premium tax credit may change. So if you will actually need to go into the system and review everything, make sure everything is there correctly, resubmit and re-enroll in your plan, and we've got a short way to do that, to re-enroll in your plan, and you may be surprised to know that, or to learn that you will have a change, either a decrease in your premium or an increase in your premium tax credit, or qualify for cost-sharing reductions, things like that. So I would urge even the currently enrolled who want to keep their same plan to go ahead and look. Full size has changed. You'll need to report that to the marketplace, and we wanted to let people know that if you have a marketplace plan, you can do that anytime. So as soon as you have you would need to go into the marketplace and update that information just so that you have an accurate account of in the system to make sure that you have the accurate amount of subsidies or tax credits applied to your account. On the next slide, it's still worth mentioning that outside of open enrollment, consumers are still eligible to enroll in what we call special enrollment periods. So in order to enact a special enrollment period, you need to have a qualifying life event or circumstance. And on this slide, you will see 6 really typical qualifying life events, like number 1, the loss of coverage. So if you've lost your job or you lose your Medicaid eligibility, then you would be eligible to enroll in the marketplace. So another example is maybe getting married or divorced. I mean, these are big life changes, maybe even giving birth to a child or adopting or becoming a foster care parent. Whenever your dependents change and your household size changes, and that enacts it's considered a qualifying life event to enact a special enrollment period. Also, gaining lawful presence, gaining citizenship will enact a special enrollment period. And of course, if you're moving, if you move out of state, then you have to cancel your current state plan and enroll in another state plan. And then I'll mention that members of federally recognized Indian tribes have a monthly special enrollment period, so they can essentially enroll year-round. On the next slide, we will dive into the best practices for outreach. And so what I'm going to do in the first few slides is really sort of talk or discuss the challenges to enrollment. And these are the barriers that the community would face in terms of getting enrolled and getting the right information. So as you can see here, it's limited English proficiency is a big barrier to enrollment. I think in our community we have a fear of immigration enforcement. That's very common in mixed status families. There's a low health insurance literacy, and I think that I want to say something about that it's really just a low knowledge of how health insurance works. I think literacy may have connotations associated with it, but it really isn't negative. And then, of course, the lack of culturally and linguistically appropriate information. And as we look at these, and we're going to talk about these in the next few slides, I'm also going to then try to address all of these in our best practices recommendations for how to really address these enrollment challenges. even limited access to internet or email or telephone. This is sort of like our technology barriers. Can really inhibit somebody from getting the information that they need in order to enroll. And I think that there's a big belief that marketplace plans are not affordable, or maybe there's a fear of not being able to make a monthly payment if people don't have a consistent job or income, and it's tough to plan for something like that. But the last 2 points are the complicated application process, and it's not easy. And it can be a challenge for most people, even with a lot of health insurance or health information or education. It can still be a complicated process. And the last note here is that insurance company notices may be difficult to understand. So let's look at the next slide where we really kind of list out the technology barriers.
Hi, everyone. Please remember to mute your lines. Thank you. Sorry, Jeanette. Go ahead.
Okay. And so for the first one, the mystery of the Internet, anecdotally, I've heard people say that they were afraid of putting their Social Security number. And I think that that's a common fear of identity theft, that a person will say, well, I just, or maybe people that even are not really comfortable with online shopping. Some people just don't want to put their information on the internet for fear of identity theft. The other is also for fear of being reported to immigration, and so we, of course, let people know that if you're not applying or if you're not eligible and you're not applying for benefits, then you won't be asked your immigration status and you won't be asked to provide any personal information. The other technology barriers listed here are slow internet speeds, and so this can be really frustrating and actually almost stop the process if you're online. And I think during first open enrollment, one of our biggest challenges was getting the volume of people through that online portal, and just because of the sheer volume of people getting through, the website was freezing and stopping, and so slow internet speeds can also contribute to that, the freezing of the when you're trying to enroll. Another that we had heard was that there were long wait times. And when you're even going through, even beyond the wait times, when you begin to speak to a marketplace or on the phone, just to go through your application and to take all of your information, it takes a while to go through that. So this can be a challenge for people who, for instance, we only have a mobile phone, so they'd have to have their charger on hand to make sure they don't run out of battery, so that can also be a barrier. Another is that in order to do the online application, consumers have to create an email account or have to have an email account. And so one of the barriers was initially creating that email address and explaining how it works to people that maybe not familiar with it or not comfortable with it. And so it just presented a whole other barrier to going through the online process, on top of the last one, which here lists creating an account online, which again is just, that comfort level of people that don't feel like too comfortable using the internet themselves. So the next slide, we'll talk about the issue or the beliefs that that the marketplace is not affordable. And so we've heard from our lessons learned and stuff that the cost has been the top barrier. So one of the fears was not being able to make your payments, and another fear was the responsibility payment. So saying, well, if I don't sign up and this is really expensive, how much is my fee? I don't want to pay this fee. And so I think there's just a lot of misinformation about the responsibility payment. Another thing we can do to sort of raise awareness about the eligibility for lower costs. So we had put out wonderful reports that were saying that the average price for a health insurance plan was, the cheaper than your cell phone bill. And I have to tell people, or I like to tell people when, we talk about health insurance and the affordability and everything, and I think it's, it's like having to consider it like a utility bill, like a cable bill or a cell phone bill, as something that, you just need to make your monthly payment on and budget for that and put that in as a priority for you. So that's one way to address this affordability issue. On the next slide, I think we're going to talk about some of the key messages that for assisters and for people that are out there working in the community. And I think I might be speaking to the choir to many of you on the phone, and if you're in the direct services area, you know the importance of having health insurance. But a lot of people, I think, need to really not understand primary care, first of all, as a term. People say, well, is that my doctor? So I think it's worth, having a conversation about what primary care is versus what emergency care is, and some of the different considerations and the two types of services, which are both covered. But I think that's one key message or education point we want to reach to the consumers. The other is know your out-of-pocket costs. So when does coinsurance kick in, for example? What counts towards meeting my out-of-pocket limit? All of these sort of like, how does this health insurance really work for me kind of questions come. The third bullet is talking about preventive services, and I think that this is where we're trying to tell people that, hey, you need to use your health insurance to stay healthy, and these preventive services are available for free without a copay. They think, well, if I have to go and I have to pay a copay, and or I'm too busy, but we have the little logo here says de la cobertura a la salud is we have these wonderful resources called From Coverage to Care in English and Spanish. And they help really, sort of walk people through the importance of utilizing your health care to stay healthy and the importance of preventive services. More on the marketplace side, the next bullet talks about tax credits and how important it is to let people know that that's how you can qualify for lower monthly premiums and even qualify for shared out-of-pocket costs, or shared cost reductions. So those are benefits that I think people don't understand. Another is to reassure our mixed status families that their information will not be used to take immigration action. And I think that message is best done on the ground in the grassroots from folks like you, because they're not going to hear it from me, or they're going to really take it to heart if they hear it in the community from a trusted source. So that's one important message we want to let people know. And the last is, if consumers don't have coverage, they could pay a fee, and the fee in 2015 could be 2% of yearly household income. So in the first year, it was only $95, or 1% of your income, and that was, the thought. Everybody said, oh, well, it's only $95, I'll pay that. Well, this year it's considerably more. It's $325 per person minimum, or 2% of your yearly household income, which can be significant to somebody, for example, who makes $30,000 a year. That would be $600 added to your tax burden, of course, at tax time. So these are some of the key messages that we think would really help during enrollment. And on the next slide, we're going to now delve into the enrollment and outreach best practices. So here are really the top 5 things that work, and we're going to talk more in detail about each of these as we go through the next group of slides. So the first is to provide culturally and linguistically appropriate services and information. And so we're going to talk about what that really looks like. The next is provide tutorials and assistance for creating an email account and using the internet. And so this is something that we didn't think about, last year, that we think, okay, well, now we need to really make sure that we have that set up, in terms of when we're doing that enrollment assistance. Make sure that's a part of it. Another thing we're urging folks to do is to really partner with your local organizations and municipalities. I think one of the issues was where people didn't know where to go for enrollment assistance, and even the enrollment assisters didn't know who else was in their community working alongside them. And so we want to really, try to make a concerted effort to let, to build coalitions. And many of our regions, HHS has created coalitions that meet regularly, and so we would encourage folks to sort of link into existing coalitions so that they don't feel like they're out there working, on their own and without any assistance, without any support. Another key thing is engaging local media. We're going to talk really more in depth about how to do that and the importance of that. And the fifth slide, which is probably the most powerful, is spreading the word on the street by word of mouth. And that's really, really key. Thank you. It's okay. Give me the next slide. So in talking about how to make something culturally and linguistically appropriate, I think that the key points here is to use language familiar to your community. You understand your community. You know those cultural beliefs and behaviors that actually help to frame someone's perspective, the way they look at having health insurance. So understanding where people come from and how they view health insurance and their health, and how they like to take care of themselves, their preferences, things like that, will really be helpful. So we, as CMS, we do what we can. We try to put as much information as possible out there on cuidadodesalud.gov for Spanish. I also will later show you the slide for the marketplace.cms.gov website, which is more for our partner facing resources. But for the consumers, there's a lot of great consumer information on Cuidado de Salud. So we would even encourage you to look at that and feel free to adapt it. I think that one of the questions we get is often when we distribute materials, it's like, well, can we use this? And yes, use it, and you can even tailor it even further, make it relevant to your community, and make it simple as possible and as easy to understand. We've even seen that Q&A, sort of like the question and answer format, works really well. So these are our suggestions. On the next slide, and to further hit that home, was how when reaching the young and healthy Latinos, we found that the testimonials and the videos, like on YouTube, were really effective in reaching them. And it's a very specific audience. We're calling them our tech-savvy, young and healthy, and potentially skeptical youth who think that maybe they don't need health insurance because they don't get sick. So we have some wonderful resources online for that community. But I think on the next slide, we're really going to talk about how the majority of people want their assistance and need the assistance, and that's in the community, in places. And it's on the first bullet here is from trusted sources for information. So we would encourage you to partner with your local organizations like churches and schools and libraries and community centers to go there, be there, where people regularly gather and provide information there. Bring those pamphlets, bring any information, do talks, hold info sessions, things like that. And even during open enrollment, I don't think that we can do enough education in the community, because education is really giving power and giving resources. So that's the first bullet to hit. The next is to make sure that you're in an accessible location. And this is also part of the, if you're a regular gathering place, then you're probably accessible because you're already where people are able to get to. So one thing to think about is it near public transportation? Or if not, maybe you can do like a satellite office somewhere that's easier to get to than where you are. The other is I'll skip down to the extended hours of service, is that many of our uninsured or currently uninsured don't have the flexibility of taking time off work. So I think it's important to encourage folks to provide services, enrollment assistance, in the evenings and on weekends, even for a few hours if you can't dedicate a whole amount of time doing that. But you're going to get people when they're off work and actually have the time to go ahead and learn more about the marketplace and the value of health insurance. The other is that it's important to learn who else is enrolling in your community. So you can go to the website, and I know that consumers may not know this exists, and it's hard for them to see, like, well, where do I go? But I want to let as many people know that you can go to the website and put in your zip code and find, like the 2 or 3 organizations that are nearest your community, and maybe write those down and put those on your website or something. Something as simple as that, by letting people know where they can go and, like putting it up in your office, or referring people to the 2 or 3 organizations that are doing enrollment in your community, I think can really go a long way. The one, if you are doing in-person assistance, it's important to have a dedicated phone number for appointments, because I've called a few places and trying to find local assistance, and where you get a phone number and they're like, oh, well, that's this person and this is their number, and so if it's hard to find or hard to get to the right person, then that can be a barrier for somebody to make that appointment. So on the next slide, I'll talk a little bit more about leveraging community resources and why. And here again, we're saying how important it is to partner with trusted community-based organizations, faith-based organizations especially. It's important to see support from local and municipal agencies that already provide social services. So these are people that are already touching the uninsured. They're already sort of have their finger on the pulse of the community. And so we would encourage people to reach out to their county health or housing or homeless or food banks. Food banks were really great partners this first time around. The other thing is that elected officials can lend support in terms of maybe getting that media to come to your enrollment event, or to helping to spread the word of who in their community is providing enrollment assistance. If your mayor is giving a speech and he says, well, you can go to this community clinic to get enrolled, that's him helping out. So that's another way the elected officials can lend support. And I think what I mentioned as before, it's important to work with local coalitions. If you know of one and are not tapped in, feel free to reach out and say, hey, can I join? I think that's totally not absurd to ask. And another thing is we mentioned that you might try partnering with pharmacies and grocery stores. So many pharmacies and many grocery stores have pharmacies in them, and so that's why even the grocery stores are sort of a nice fit for it, because the pharmacists are a great resource in your community, and they already have relationships with people that come to their stores and the people that they know. So those are great partners to reach out to as well. On the next slide, we're going to talk a little bit more about maybe the nuts and bolts of a successful enrollment event, or even an outreach event. It doesn't have to be an enrollment event, but so here, for instance, we're going to look at, you need to set up an area with somebody to help consumers set up email accounts. It's always helpful to offer childcare or a supervised play area for families to come and keep their children occupied, especially if they're going to be waiting an hour to just an hour in the process and maybe a half-hour wait to see somebody. So that's always good to think about. And one thing might be nice is to structure sort of a space or a side place where people can get marketplace education, like where somebody can do a talk and give like a 10 or 15-minute overview of how to select a plan, which is what they're about to go do once they start enrolling. That would be really helpful to them if they sort of think it through before they do their online application. And, of course, to explain the eligibility for lower costs and how that works. Another thing is to have a private area for a laptop or a computer station with, if, best case scenario, a high-speed internet connection and access to a printer so that you can print anything off and people can have something to take with them as proof of, like, they enrolled, like a proof page. So that's helpful. And also anticipate hosting large numbers of persons because you never know how many people are going to come if you say you're going to do a talk, an education event, or this. So it's good to think about in advance, maybe where people would line up, like on what side of the building and what side area, where you would have seated waiting areas. People would be waiting for the enrollment assistance. So these are the types of things to think about. On the next slide, I'm just going to show you some of these really neat flyers that we offered. And these are available on our marketplace.cms.gov. This is a partner-facing website. And so these are the examples of the types of flyers we had. And so here's specific to Florida, for instance. And I do not know what state that other one is. Oh, New Jersey. There you go. So one is from Florida and the other one is from New Jersey. So you can find nice graphics like this that you can then tailor and put your event and date in there. On the next slide, we're going to talk about the tips for engaging with local media. And so your media staff really do need to be educated, and they want to stay up to date on what's going on in the marketplace, how's enrollment going. Things like that are really important to helping to get coverage, to get media coverage, to get that earned media coverage, is by just making sure that they know how things are going throughout the line, that they follow your story, because basically your work is telling the story of how things are going. That's one way of looking at your work. The other is to seek opportunities to do public service announcements. You never know, they might be interested in recording even just something for the radio, which is really easy to do. A 30-second or a 20-second spot of, come to, La Clinica for enrollment assistance. The phone number is, 6 whatever, and so that you provide a phone number that you're doing assistance, and then say we operate from weekdays 5 to 9, weekends 9 to 1. That's a quick PSA that your radio station might do for free. The other is this, the importance of sharing personal stories. One is in terms of, getting that word of mouth on the street so that people hear of, wow, you got covered, and, what's that like, and it becomes more familiar to the community. But also the local media would be interested in, doing a story on somebody who got covered. So that also is an opportunity for a story. Always invite the media to your events. That's always important. And so like I mentioned, it's good to just send regular updates to the local media about your enrollment opportunities. That's really helpful. The next slide, we'll see we have for advertising with deadlines. So we found through our lessons learned and market research and stuff that advertising with deadlines really helped. It was really effective and could be for anybody. So the next slide is really specific to assisters, I guess, and most of this presentation really is specific to assisters. But I think that even if you aren't doing the direct enrollment, that you could appreciate this. The importance of, for example, training bilingual staff that understand your community, and then just a simple ask of saying, telling people after they enroll to, ask them to tell their family to help spread the word. When planning an enrollment event, it's always great if you could, for instance, partnering with a pharmacy, provide a free service or a screening, such as for diabetes or for HIV. And then, of course, send weekly updates to your local radio and TV outlets, and you can refer them to people who would be open to being highlighted. On the next slide, I wanted to show you our new health insurance marketplace. This is the partner-facing website. So this is really a place for our sisters and our outreach partners to get all those resources. So if you haven't already done so, you can go to this website and sign up to get email updates. And that's really key, so that anytime we post a new resource to the site, you'll get an email update letting you know that there's a new resource available, and it'll send you the link to it. So if you are already on here and you know sort of where to find stuff that's been relaunched recently, so it'd be worth going through and looking to see what's come up next. And we're almost on a daily basis putting new information up as we're really getting close to open enrollment. It's only 4 weeks away, well, 5 weeks away. So in the next couple of weeks, I think it'd be really key to get signed up for those email updates so that you know when we post new resources. And the last slide in my deck, I think, is, a few more, is in terms of if you want those publications that you will find on that marketplace.cms.gov site, you can order them to have them in hand by print. So I'll sort of walk through how to do this. First thing you'll need to do is go to that website and create an account. It's really simple, and the only thing it's going to ask for really is the type of organization you are. So if it's an advocacy group for seniors, for example, then you'll plug that in there. And then within 3 business days, we'll grant approval to the account and send you an email notification. So once you receive that email notification, you will then be eligible to go through and access your account and order all the publications you want. And there are different limits, I think, for different pubs. They'll say there, like, if you can order like 500 or 100 or whatever. But this is really the resource to go if you want those handouts and information to pass out in hand in your community. And there are many resources available in Spanish as well. Next slide. I think I talked about how to find in-person assistance in your community a lot in terms of looking at the website localhealth.healthcare.gov, because we have that search tool to find it. But here's sort of the list of all the other types of in-person assistance and all the other types of people that are out there doing enrollment assistance. So agents and brokers, for instance, are something we don't talk about a lot, but they're out there also enrolling people in the different health plans that they offer. And when they're doing their work, they simply just say, well, I'm a broker or agent for this health plan or that health plan. Some brokers do more than one health plan, and an agent might typically only work for one health plan, but a broker might work for or be able to sell a plan from different health insurance plans. But they can also provide in-person assistance for the marketplace. So that's another partner to think about. And on the next slide, I'm going to make my soft pitch as to if your organization is not already signed up to do enrollment assistance, I would urge you to maybe consider it, because you never know. If you're already in the community and you're already providing social services, it's a good fit for you. It might actually be a service that you could provide, an additional service you could provide to your clients. It's a good way to say, oh, well, we do this as well. The way to apply is going to that website, marketplace.cms.gov. The application is really simple. It asks you simple things, and the training for the assisters is all done online. So the application is done online. The training for the assisters is done online. And go through, once you're designated as an organization, you're given an ID, and that ID is then used to certify any of your sisters. Your sisters then get a unique ID, so that when you go through and do the enrollment assisters, it just attaches it to the unique ID that you have. And just to mention this, just sort of like the type of organizations that we designate are those that are typically already doing the providing social services and that already have processes in place to screen staff and volunteers to ensure that they protect personally identifiable information. And this is really important. And I'll also caveat that in many states, in addition to our CMS certification, you'll also need to get a state certification to do enrollment in the states. So the majority of the states have that additional requirement, and that is also in most states online and done pretty quickly. So that is next slide is really what you can do if, for example, your organization is not interested in doing enrollment assistance, but you do see the value in helping to get the word out. You can become a champion for coverage, and you actually go in to the website and you sign up your organization, you give a point of contact, and then we'll keep you informed of all the marketplace updates that come through, all the different resources that come through. We do webinars on a regular basis for the champions for coverage, so we try to do as much in terms of providing resources to the community as well. So some of the things that a champion for coverage can do is, for example, you can just educate your staff and your members about the marketplace. You can send an email to your networks. You can post a link to healthcare.gov or Cuidado de Salud on your website to help drive people to where they can find more information. You can hand out or display information in your office. You can host a conference call or a webinar like this. And feel free to reach out to me if you're interested in something like that. We can do that, and you can also include a story about the marketplace in your newsletters or publications. So there are a number of things that you can do. We talked about maybe trying to seek out opportunities to do public service announcement. And then for those that are really savvy in social media, there are a ton of content out there already. If you follow at Cuidado de Salud on Twitter or follow at healthcare.gov on Twitter, it's really helpful to retweet all that information. It's easy and it's a way to show support. For example, right now we have a thunderclap that we're trying to get out. So if you want to find out about it, you can go to hashtag HHMSalud and help us to support us and sign up for our thunderclap. It's going to go live October 10th, so we'll need people to sign up before then so that we have enough support, and they'll send out the major blast on October 10th. Okay, so I think the last slide is the Stay Connected slide with all the good information, and Judith will pass it on to our colleague.
Great. Thank you so much, Jeanette. That was such great information. And now we're going to hear from Lilia Fletcher Moreno from Louisiana, and she's going to give us more of a state perspective and some best practices she has found as a navigator. Lilia?
Hi, how are you? Good evening, everybody.
Good afternoon.
Can you hear me?
Yes, we can hear you.
Okay,
Go ahead.
perfect. Excellent. The Hispanic community experiencing health insurance through Marketplace. This presentation based on experience educating and enrolling the Hispanic community. So we will see, next please. We will see statistics, general Hispanics, barriers, education information, reliable information too, how to prevent fraud, that is important, consumer fraud prevention with specific events, and eligible immigration status list, the ACA and Latinos. Next, please. Okay, statistics, general. And we'll see more than 8 million people select marketplace plans from October 1st, 2013 through March 31st, including additional special enrollment period activity through April 19. So it's very significant that we see that everybody try to get information, try to afford the health insurance through Affordable Care Act. So obviously it takes time. It's something that is new for everybody, include the people like us that are involved in this space. So we'll see that on of the more than 8 million is brief information, 54% of females and 46% are male. 34% are under age 35. 28% are between the ages of 18 and 34. 65% selected a silver plan, while 20% selected a bronze plan and the other plans. So 85% select the plan with financial assistance. Today's report measures enrollment as those who select a silver plan. Next, please. So Hispanic statistics, we can see here that the federal marketplace also reported the race ethnicity of its enrollees. The application for coverage through the federal facility marketplace contains questions on race and ethnicity, both marked as optional. 31% of enrollees didn't report their race or ethnicity or choose other. This is something that obviously is free rights free that the people can choose to say what is the ethnicity or not. So it's a little inconvenience, but we think that we can afford, in past years, we can afford more information. So total who selected marketplace plan including where race ethnicity is reported excluding unknown others. So it's more than 400,000 people talking about Hispanic. That means 10.7%. So we can compare it for white people, 62.9%, African American 16 to 7%, Asian 7.9%, Latino 10.7% that I told them, and multiracial 1.3%. So Latinos border is, everybody that we have several specific states. The border rates, states obviously have the highest share because of Latino among marketplace plan selections. With Texas at 33.6%, New Mexico at 31.1%, Arizona at 24.2%, and followed by Florida at 19.2%. Next, please. Okay. We will see right now the values. We heard a little bit in the last presentation, but these varies is that I will talking is basically my experience like navigator. So something new, definitely something new for Hispanic community. Even a lot of Hispanic never had health insurance before. So it's something that we need to see that a big barrier. I need to work in order that the people try to get more information about it. Low application, 100% is this low. So everybody needs to have health insurance, they qualify. And for qualify will be citizen or lawfully living in the United States. And the other barrier is don't need it. Several people say, not only Hispanics, a lot of people say, I don't need it, but I don't think that I need to take it. So it's thing that we need to fight with these kind of things because the people need the health insurance more than the car insurance. So it's something that we need to put right now in our budget and think that everybody can have a health inconvenience. And I don't know if you know, but the first place in the United States that the people go to the broken in her financial life, the first place is old medical. So if the people have problems with her health, they need to go to the hospital or the ER services. And believe me, it's very the high risk because it's very expensive if you don't have health insurance. The other thing is English knowledge, and it definitely is that we try to help people, especially the Hispanic community, in order that they can understand that they are not alone and exist people like navigators, like assisters, like CAC, volunteers, etc. They can help them in Spanish, and we have a lot of tools that they can afford, and in order to understand more the health insurance in Spanish. Computer knowledge is something, and even people that have English and have computer knowledge, but they feel afraid to do it because they don't want to make mistakes, and probably they don't understand too much about health insurance, so they need help. The other thing is reliable information. And here I would like to explain a little bit about the navigator's function. In few words, is consumer assessment. That is very important. Consumer education through presentations in Spanish and English with PowerPoint. We can give and offer this kind of tool in any kind of, the groups like churches, schools, and, the associations that they need that we go and give that kind of presentation. So the other thing is account creation and maintenance, application and renewal of coverage, eligibility, that is important too, enrollment, exemptions, appeals. Remember that this is something very, very important right now, and we can help the people in order to get appeals. Consumer outreach and navigator reporting is one of the few tasks that we need to do in order to help the people. So affordable money, the dollar sign means that a lot of Hispanic, they don't have enough money to pay it. So they need to know that this is something very important, and it's more important than buy things that are, like clothes or more food that you don't need, etc. So the health is very important. Immigration status. So I told you that everybody that are lawfully living in the United States needs to get health insurance in order to not get the penalty. And the IRS, that when you try to get health insurance through application, the IRS information is very important. So not all that information will be matched with IRS. So it's very important to say the truth. Okay, so the next slide, please. On education information, I will see that you have all the tools that we said already, and after that you have LA navigators to Facebook, Twitter, and Facebook too to healthcare.gov. So in order to get more information, presentations, we already have approved radio programs in Spanish, TV programs, health events, health fairs, brochures, and flyers. So you already see that we try to resolve all the barriers in order that the people understand more all these inconveniences. Next slide, please. Frauds. In frauds, it's very important that you be clear that identification. When you talk with somebody by phone, personally, you need to know if that person is a curious person, have a certification in order to give you information, reliable information. Privacy Act extended. When the people try to help you, you need to sign a consent, even in English and Spanish, because it's available in Spanish too. So try to get that consent, because all your information will be private, okay? Next is be informed about the healthcare choices. Protect your private healthcare and financial information. Don't get information to other people. Ask questions and verify answers, so you can realize that the person knows about the health insurance through Marketplace. And get called from the Marketplace and report suspected fraud if you think that something is wrong. Next, please. Consumer fraud prevention specific events. Let me tell you about this. New Medicare cards. What about of this? The person try to tell you, for example, you need 6 scam artists. may contact consumers claiming that under the Affordable Care Act, consumers will need a new Medicare card to prevent losing health care coverage. So the tip is Medicare receipts don't have to comply with Affordable Care Act. Therefore, no new Medicare card is required. If someone contacts you requesting your Medicare number or other personal information, simple hand up. The insurance marketplace is only for those persons who don't have any other form of health insurance coverage. So, next one is fake insurance card. Consumer may receive a call from the authoritative sounding person claiming that a new or a special insurance card is needed for medical treatment under the Affordable Care Act. The caller claims that without a new insurance health, the consumer will be faced with severe penalty. In order to receive the new insurance card, the consumer must disclose personal information such as a social security number or bank account information to the scam artist over the phone. So be careful. The tip is be cautious of verify the identity of the person requesting the information with appropriate federal or state agency, especially when you didn't request to be contacted, okay? So fee for advice of enrollment. Consumer may receive a call from a scam artist, so who offers to help them enroll in insurance marketplace for a fee that's wrong to. Be aware of callers representing themselves as a government official of insurance agents. There is no advance fee for information or to enroll. Only those officials certified by the federal government may assist consumers with insurance options and to assist in enrollment in insurance plans. So verify the identity of the purport officials, and that will be good in 318-2596 or healthcare.gov or cuidadodesalud.gov. Phony door-to-door solidators and fake navigators. Imposter or other solicitors may go door-to-door. Be careful because claiming that the Affordable Care Act requires consumers to receive an Affordable Care Act card, or say that he or she will enroll the consumer on the spot. The CON artist tells the consumer that his or her social security number and bank account information is needed to receive a phony card or to enroll. Be careful because you need to verify the identity of the person in 318-2596 Form 2 or healthcare.gov too. Or the threat of jail time, that means that urgent emails and calls, be careful too. Consumer may receive an email or call stating that the consumer will face jail time if she or he doesn't purchase health care coverage immediately. The phony website or email directs consumer to click on a link, or the CON artist directs the consumer to give credit card information to purchase health insurance at a reduced rate. So be careful and never give out your personal information through email or over the phone if you didn't request to be contacted. And fake health insurance plans. Fraudulent insurance plans are being offered by scam artists for a low monthly fee. So the consumer must provide social security number and bank or credit card information. Unfortunately, once the consumer provides information or makes a payment, the CON artist takes your money and now has your personal information. That is so bad. So be caution when someone contacts you without your requesting the contact. Verify the information, the insurance company participating on the identity of the person contact, so that be good that you dial 800 and 318-2596 again or healthcare.gov. And the last one is fake medical discount plans. Be careful because it exceeds a lot. And a scam artist will claim that he or she is selling you a discount plan that is the same as the plans under the Affordable Care Act. So it's no qualified health plan. So in reality, the plan is only a medical discount plan that typically require that the consumer pay a fee to become a member for a discount club. Not only does the consumer lack health insurance, but is out rather large sums of money. So the tip that you need to apply is medical discount plans are not the same as health insurance, as these discount programs don't provide comprehensive health insurance coverage. So verify the company's participation in the same phone numbers and the same health. So general fraud prevention tips. Protect your identity and your personal information. Verify the identity of person requesting your personal health or financial information, especially when you didn't contact the person or request information. Be aware of callers of door-to-door. Solicitors using high-pressure sales, tacting, or claiming to be government officials. So we'll see that consumers should only receive enrollment assistance from those officials certified by the federal government. Next, please. So we now will see eligible immigration status that you can take this list that is a big list that you can afford this list through the www.healthcare.gov or www.cuidadodesalud.gov, and you can see all the list of eligible information status for healthcare coverage through the marketplace. And next one, please. Continue the temporary protect status, which is another type of immigration status. Next, and is the certain individuals with employment authorization documents too. Next, please. And finally, with lawful temporary resident, and finish with resident of American Samoa. That is the last one. So finally, the Affordable Care Act and Latinos. What's going on with this? The Affordable Care Act is making health insurance coverage more affordable and accessible for millions of Americans. For Latino, like other ethnic minorities, the low addresses, inequities in access to quality, affordable care, health coverage. So Latinos suffer from certain illness at higher rates than non-Hispanic white Americans that you need to be considered. At the same time, Latinos are one of Americans' most disproportionately uninsurance population. Next. ACA and Latinos. Members of immigrant families may qualify for Medicaid and CHIP coverage. So in this part, you need to see your immigration status too. So suppose that you need to have 5 years with your resident or another type of immigration status. But sometimes a Medicaid approved in order to see their income and other stuff. Many immigrant families are of mixed status, with members having different immigration and citizen status. Even they will probably have one lawfully and another unlawfully. And that no means that you can afford the insurance. Obviously, that person will not have a lawfully immigration status, they can afford a health insurance through Affordable Care or marketplace. But you need to be aware that the other person in your household needs to get it in order to not get a penalty. People without lawful immigration presence are not eligible to enroll in the marketplace, but by the same time, they are not eligible for penalty too. Millions of Latinos across the country are already benefiting from the stronger coverage and consumer protections made possible by the Affordable Care Act to the marketplace. And next one. And the last one is the resources. So you can go to www.healthcare.gov or cuidadodesalud.gov. And the Centers of Medicare and Medicaid Services that have a lot of information, and it's a reliable information. Age healthcare sources and Medicaid services are 42914 that is available information. And I'm finished, and thank you for having me. Hello?
Yes. Thank you so much, Julia, for that presentation.
Thank you.
We have several questions.
Okay.
For both presenters, and one of them comes from John from Georgia, and he asks, have the problems with the Affordable Care Act Spanish language website, meaning poor translations, have those issues been resolved, Jeanette?
Hi, yeah, that's a good question, and we just recently refreshed our website and went through and tried to do just that. So I would encourage folks to go to cuidadodesalud.gov and see the new site. It's newly organized, and yes, we've gone through and tried to really be responsive to all of the feedback and the comments that we received.
Great. Another question we have from Scott, and he asks, do we have any official documentation from CMS or other, government organizations that guarantee that undocumented people will not be reported to immigration services if they give information to the marketplace?
Yes, actually, that documentation is available on the Department of Homeland Security website. So if you look under the immigrations, I think it's ICE, ICE, they have a section on this, and I probably could send it through the group as a follow-up, but the information on healthcare.gov does say that, but the specific policy is with Homeland Security and Immigration and Customs.
Yeah, please send that our way. Our next question is, has a system been developed to confirm documents have been received by the marketplace when documentation is requested to prove identity?
Yeah, I don't have a good answer for that right now, other than if they're uploaded online, that's the best way to know that they're being recorded and they're attached to the account.
Okay, and then we have a question from Alejandro from Georgia, and he asks, as a navigator, where do I direct the consumer to check for confirmation? And I imagine that goes along with the prior question, to prove identity has been received.
Yes, and I would say call the 1-800 Marketplace number, 1-800-318-2596, I think it is. And that is your best bet for verifying that they have everything they need from you. And even if they can't say to verify, like if you send it in the mail, and I think it's just good to make a note on your account when you call the phone number to say that you had sent it through the mail.
Great, thank you. And then this question comes from, are there online communication resources and or tips or best practices for engaging Latinos online and through social media? And what messages work best?
Okay, so for online engagement for Latinos, we have quite a bit of resources, and I would refer everybody to cuidadodesalud.gov on Facebook, because almost every day, we post a really smart infographic with a message. And over the next couple of weeks, we're actually going to be putting out a nice set of messages to highlight the resources and the From Coverage to Care materials that we have. And so if you want some really smart, nice graphics to use, that would be it. Also, the messages are short, especially on the Twitter. Like if you want to take that 140-character message and use that, that's the best way, because then you get the up-to-the-minute, the latest stuff. So yeah, if you're interested in social media best practices and how to engage, please do take a cue from what we're doing on our Cuidado de Salud site.
Great. Lilia, there was a question for you, and it was, how are you all dealing with outreach, particularly in rural areas?
Well, we are available in our web, www.healthcare.gov. They can type in search, they can write navigator, and they can reach all the organizations. And then when you get in organization, you can see what is the most closer from your address. And then you are available to find the phone numbers and everything in order to get information about navigators. And when we take the appointments, well, my way is to take appointment with the person because I'm trying to search a little bit information in order to see if the person qualifies to make application, the first thing. And then if I think that it's okay, everything, then I will make an appointment and then I can see the person. Navigators we don't have offices. We need to see the persons in public libraries, schools, places that are open, for public. You know, you can go to their homes and they can go to your home for security rules. So that is the way that we can work. So and it will be by appointment because probably one application could be taken 30 minutes, 20 minutes, and probably 2 hours, depending household size. So it depends.
Great. So that was the last question for the chat. I'm going to open it up for maybe 1 or 2 questions if anyone has any live, and if not, you know.
I have a quick question. This is Alejandro from Georgia. The suggestion that came in to call the marketplace about the documents that are requested. Unfortunately, whenever my consumers called, they were not able. The marketplace was not able to confirm where that document went or when it arrived. So I'm concerned that a lot of the same problems are going to persist this time around again, and then a lot of Latino families will not be insured.
Let me tell you something about it. It's a lot of people. Remember that we have a technical serious inconvenience when we start the program by online even. But and in order to be a little bit quick, they decide to, okay, you are eligible, excellent, but you need to send documents. I prefer, and I would like to see that, that you need to send the documents no matter if they request or not. And the order, you can download by computer, that is easy and fast, but I prefer that you send to the documents, take a copies and send to the address that everybody know what is the address. And you can get the address by online too. But when you go to the mail office, try to take the certified way. And then wait like 10 days, available labor days, and then try to check if your information is already in the system. That's the way that I'm trying to say all the people in order to make sure that everybody is in the system.
Okay, thank you.
You're welcome.
Any other questions? No? All right, well, thank you so much for joining us. I apologize that we went a little bit over time, but it was a lot of great information. If you would like to present a webinar or request free capacity building services from our Capacity Building Division at the Latino Commission on AIDS, or learn more about the Latinos in the Deep South program, please contact me, and my information is on the screen. I will also be sharing these slides along with the recording for everyone, and along with the contact information for Jeanette Contreras and Lilia Fletcher in case you all want to contact them with any additional questions. Thank you so much for joining us today.
Thank you. Please stand by.